We are back, and we are joined now by Dr. Uche Blackstock, physician, founder and CEO of Advancing Health Equity, and author of Legacy: A Black Physician Reckons with Racism in Medicine. Dr. Blackstock, thanks so much for coming on this program.
Thank you so much for having me.
Sure. I mean, today's the first day of Black History Month, so it's great to have you on to talk about this ever-pressing issue of these massive disparities in healthcare and health equity along racial lines that are as persistent as any piece of systemic racism in this country. And I want to get to that in a second, but your book also has so much of your personal experience embedded into it that I think is really important for people to understand the legacy of your mother, the work that you and your sister do, and how that kind of informs why you felt so inspired to do this kind of work. If you don't mind talking a bit about that.
Sure, absolutely. The name of the book, Legacy, actually, has a double meaning, as you allude to. It's, the legacy of being a second generation Black woman physician. My mother, my twin sister Oni, and I are the first Black mother-daughter legacy from Harvard Medical School. And that was that happened in 2005. So, we're still making history in ways that, we can celebrate, but also seem a little bit inexcusable. But my mother was born here in central Brooklyn, where I live now, under very different circumstances. She was born to a single mom on public assistance. They moved around a lot. But my mother was very, very curious and had a strong work ethic, and was lucky enough to be the first person in her family to go to college, and had a chemistry professor there who encouraged her to apply to medical school, which was something she hadn't really thought about. And so she applied to medical school, got into all of her medical schools, and ended up matriculating at Harvard Medical School, where she obviously felt like a fish out of water. There were kids in her class whose parents had written some of the textbooks they were using. But one of the things about my mom is that, she could have gone anywhere after Harvard Medical School, but she came back to New York City. She trained at Harlem Hospital, and then she ended up practicing in the very same neighborhood that she grew up in central Brooklyn, caring for her family and neighbors. And so that was a huge lesson that my sister and I learned from her, is that, you go to these prestigious institutions and you come back and you work in service to your community. So the work that my sister and I are doing now, the health equity advocacy work, we both have consulting firms where we work with healthcare organizations around bias and racism in healthcare to close the gap in racial health inequities. But really that legacy is continuing the work that my mother started, when we were younger, where she would work with other Black physicians to organize community health fairs and connect patients to the services that they needed. Then it didn't have this sexy term health equity, but she was doing health equity work, and she was really looking at her patients in a way where she was thinking about the social and political contexts in which they lived, worked, loved, and prayed. And so that's the kind of holistic way I think about how we should care about our patients.
And your mother sadly passed away from leukemia in her late 40s. What was that experience like for you? I mean, of course, it's completely tragic, but to go through that kind of intense medical crisis as you and your sister and your mother have this kind of heightened awareness of what it means to be a Black woman getting this kind of care in America.
Yeah, no, absolutely. I mean, we were 18 years old when she was diagnosed with acute myelogenous leukemia, and she really, she took such great care of herself. It really was a shock. She was only 46 when she was diagnosed, and 47 when she died, a year older than I am right now. But at the time I was so young, I didn't even really understand, kind of the risk factors that she had, that the fact that as a Black woman, the kind of leukemia she developed was very, very rare. And it really was as a practicing physician that I started really kind of relearning sort of all the educational gaps in my my training. And I did some research for the book, that my mom grew up in neighborhoods in central Brooklyn that were Superfund sites, that there was, toxic dumping. And when my mother was getting treated, we went and got a second opinion at Dana-Farber Institute in Boston, and they told her it looked like from her chromosomes. She had been exposed to radiation at some point early in her life. And so that's what I write about in Legacy, that, there was a chance that my mother was exposed to radiation because, she lived in poverty in these neighborhoods where, toxic dumping and exposures happened. And that could have been implicated in why she was so young when she was diagnosed with this disease and ended up dying prematurely.
And I mean, the the environmental racism aspect of it, I want to get to as well, because that's so key to understanding many of these current kind of racial disparities. I mean, Flint, Michigan obviously comes to mind, but there are countless Flint, Michigans across the country, and Superfund sites, and all of those things that you discussed there. But something that really struck me in your book was that the percentage of Black physicians was actually higher in 1910 than it was in 2008, nearly 100 years later, when this was tallied. And you talk a bit about this thing called the Flexner Report in 1910, which seems very much at the root of this very low percentage of Black physicians in this country. Talk a bit about what that was and how
Sure.
we're still living with that.
Yeah, and I should just give context. Like, growing up, I thought most physicians were Black because that's who I was surrounded by when I was younger, by my mom, by my pediatrician, all of the women physicians that she worked with in the local organization. And so when I got older, I was like, wait a minute, our percentage is really that low. And it really was, as a practicing physician, again, that I was on this journey of trying to unlearn and learn those educational gaps. And so one of the, discoveries that I made was this Flexner report that actually was, commissioned by the American Medical Association, which is one of the oldest and largest organizations of physicians and has its own kind of horrific history with bias and racism, and the Carnegie Mellon Foundation. So they commissioned an education specialist named Abraham Flexner, who also in his writings had very, very racist ideas about Black people and Black students. But they commissioned him to go around to the 155 medical schools in the United States and Canada, and to hold them up to the standards of Western European medical schools, and in the US, specifically to Johns Hopkins. At that time, there were 7 historically Black medical schools, but this report led to the closure of 5 of them, leaving behind Howard and Meharry medical schools, which are still open to this day. But obviously, because of the legacy of racism, of generational wealth, those Black medical schools did not have the resources, did not have the equipment, did not have all of the criteria that were needed to fulfill these recommendations that Flexner put out. And so it was interesting. In 2020, there was an article in the Journal of the American Medical Association that calculated and estimated how many physicians those Black medical schools, those 5 schools that were closed, would have trained. They estimated that between 25,000 and 35,000 Black physicians would have been trained in those medicals had they remained open. And when I read that, I cried. I cried because I thought, what a tremendous loss to our communities, what a tremendous loss to our patients, the hundreds of thousands or millions of patients those physicians would have treated, the students and trainees they would have mentored, the research that would have been done in Black health. And so I thought it really was important for people who read Legacy. It's really for a broad audience to understand why in 2024, even today, why the numbers of Black physicians are so low. And it has a lot to do with the Flexner report. I also should add that, the recent SCOTUS decision on race-conscious admissions, I think, could have a very similar ripple effect as the Flexner report, because it will impact, the diversity of who's admitted to pre-med programs, to medical schools. So I think unless these academic institutions try to find ways to make sure they maintain a diverse student body, we may see a similar impact from the recent SCOTUS decision on Black health and Black communities.
What were some of the reasons that the Flexner report gave for shutting down these medical schools?
Right. So So essentially, there were a few areas that they said all medical schools should have a certain standard for. So admissions criteria, like certain types of laboratories, certain numbers of physician scientists as faculty. So, obviously, Black medical schools,
Right.
probably, didn't have a lot of physician scientists or laboratories. And I think that like to use like the same standards for them as predominantly white institutions that had a totally different set of or amount of wealth and resources was unreasonable. But he suggested that Black medical schools were putting out underperforming, physicians and medical students. But he was using these very stringent criteria that I don't think was necessarily fair to compare Black medical schools to, and doesn't necessarily mean that those schools were indeed putting out poorly qualified physicians. I will say even now, medical schools go by, use MCAT scores and GPAs, and we know that, the MCAT, which is the exam you take for to get into medical schools, that is impacted by socioeconomic status. Like, if you are right,
course.
so if you're right,
Yeah.
so if and that doesn't necessarily predict if you're going to be a good doctor, right? So there's so many other ways that you can predict or encourage, people to be good physicians that don't necessarily, rely on scores and MCAT scores or GPAs. Like, we need a really more holistic idea of what it is to be a good physician, because we actually already see that if schools are using these standards, why do we still have these racial health inequities today, right? Like, you would think everyone would be getting the best care.
I mean, let alone the fact that going to medical school, if you don't have the money, you're going hundreds of thousands of dollars into debt immediately. And then
absolutely
the compounding effects of that are, okay, so the kind of advocacy that you do, right? Maybe if you're a Black medical student who's in that amount of debt, or just a medical student who's in that amount of debt, and you want to be more community focused, you're probably going to go to a more high paying job to pay off your debt. And then there's this brain drain in poorer communities.
Exactly. And we see that already. We see that in specialties like primary care for adult and pediatrics, because of our current, for-profit health insurance system that reimburses primary care physicians at a lower rate. And so we have a lot of medical students going into subspecialties like dermatology or plastic surgery or orthopedic surgery, where they can get compensated more. They're able to pay their loans back. And so there are some medical schools that are becoming tuition free or giving grants to students. And I think that really the obligation of medical schools really should be to prepare physicians to take care of a diverse patient population and to work in underserved communities. So there should be incentives given to students to work in, marginalized and underserved communities, like many Black communities in this country. And there simply are not, there are some, loan repayment programs through the federal government, but I think it's up to private institutions also to make sure that they are training medical students to work in those communities, as well as applying for primary care and like primary pediatrics, geriatric specialties.